Hey everyone! So in this video, I'm going to chronicle my entire personal experience with ankle surgery that I just had on New Year's Eve of 2019. This is going to be part of a multi-part series where I'm going to be discussing the history of my condition, my experience in the day of surgery, and all aspects of my recovery, including pain management, navigating around the house, on crutches, how to bathe, how to go to the bathroom safely, even what it's like to get back into driving a few weeks when you're starting to navigate getting back into doing your regular routine of thing while still on crutches. I apologize in advance for the less than perfect quality in some of these videos. It's actually my very first time in publishing anything to YouTube, and I got a lot to learn. But you're gonna get a real deal, real-time look at exactly how I'm feeling and progressing, which hopefully will give you some idea of what to expect if you or someone you know has to have an ankle or some kind of foot surgery. So if you wanna find out more about what this personal experience has been like for me, then check this out. I'm going to give you the real deal. This past week, I had 2 separate procedures performed on my ankle after waiting about a year and a half to finally get a few issues resolved that I've been dealing with for quite a while. I am not a doctor. I'm not a professional. This is purely my own experience, so just take that for what it's worth in watching this video. So let's rewind a little bit, and I'll tell some of the backstory about how I got to this point where I actually had to have my ankle operated on to hopefully resolve some of the issues I was having. About a year and a half ago, I started working on trying to get back into running road races again. I had been running at the time, probably between 5 and 20-ish miles a week or so. And things were working out pretty well. I was definitely feeling in really good shape, and I was, keeping up with some of my faster friends, running at work, and definitely feeling, like I was ready to kind of get back into competitive racing again, which I used to do in high school and college. The problem started when I was, the day before this one race that I was going to do, I was coming off of a track and doing some road work, like high speed work. And just as I was slowing down, I felt this incredible pain right behind my right ankle. Just the little joint that just kind of meets between the large part of the ankle bone there. I think it's called the talus. I knew something bad had happened because I was limping. I was in pain. That pain lasted for probably a good hour before I could walk completely normally again. And I was really worried about the race the next day. I just rested it, put a little ice on it, and, went to work that day. The race was in the evening. And after work, I drove home, got into the race, and the race went fine. In fact, I did really well. I actually placed 3rd in my age group at the time. So I was really happy about that. At the time, I was 48 years old. I'm over 50 now. But a problem was it wasn't a fluke, because in the days that followed, as I went back into just normal, training and running, I found that when I would run downhill, especially, I would feel this little bit of clicking going on behind the ankle. It definitely became a much more serious problem, and that's when I was feeling, this little click, 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 bam, it would just pinch me right in the back of the ankle, and I would have to stop. My running for that day was over. It was really difficult to locate, precisely, I couldn't tell if it was the Achilles. I couldn't tell if it was, what part of the ankle it was. All I knew was that it was basically between the Achilles tendon and the bone behind the ankle. So I went to see a doctor and, of course, got an x-ray. That doctor couldn't really tell me that he had seen anything specifically that was wrong, unfortunately. He had recommended a bunch of therapy, and I did a bunch of various ankle strengthening exercises, both, in the doctor's office as well as at home and at work. And I would still try to go running, and unfortunately, intermittently, the problem would just invariably keep coming back. Sometimes I would be able to complete the run and it would be okay. Other times not. It just would come back and I would get this impingement and this clicking. I definitely found that it happened more so going downhill and on uneven surfaces than when I would go uphill or on flat surfaces. After having gone to see a couple of doctors and realizing that therapy wasn't working, I went to go meet up with a surgeon who looked at my x-rays, a fresh set of x-rays, and an MRI that I had done. And he told me that I was suffering from something called Trigonum syndrome. So what is Trigonum syndrome? Basically, it appears to be a condition where there's an extra bit of bone that forms at the back end of the ankle, and not everybody has this. It occurs in, depending on what you read on the internet, anywhere from 7 to 30% of the adult population. It appears to occur in adolescence, and then as like a softer tissue, and then it can kind of calcify and become bone. And I guess over time it can become something that can irritate the tendons. It wasn't something that was preventing me from walking or doing my work functions. So I had to put it off, and I had to unfortunately put off running for a really long time. When the project that I was working on came to an end, I decided to actually get a second and even a third opinion. And then after having considered my options, I went with one of the 3 surgeons who also agreed with the first, that there was an issue there with that os trigonum, that I would have that basically filed down. Now, there was another issue with my ankle that I had identified with the doctors at the time that they also felt that they could address. This was not something that was preventing me from running, but it was a rather severe irritation. And that is, I had this irritation in the side of my ankle, the peroneal tendons that kind of wrap around the outside of the ankle bone, were really irritating me. And they had been for as long as I can remember. I think even as far back as high school, I can remember that they would sort of subluxate and kind of fall out of their groove, and they would kind of flop around a little bit at times. And I think just over the years, that condition just got a little bit worse for me, and it started to feel a little bit like pins and needles, almost like bee stings in there. It would be really quite irritating at times, and it wasn't something that was always plaguing me, but I would feel it, at many points in the day, throughout my life, basically. So as I mentioned this to them, there were some different opinions on how to address it. One was to do some sort of perineal groove deepening, where they would actually literally groove a hole underneath the tibia, in the tibia, to sort of seat the perineal tendons better in their little channel that's supposed to naturally be there. But the surgeon that I saw had recommended a little bit of a less invasive option here, which was to remove this little extra tendon. I can't think of the name of it off the top of my head, but basically he removed something extra that I had there that he said was non-functional, that it wouldn't affect my balance or my performance in running and in my other hobbies. And it seemed like a bit of a safer way to go than what seemed like a radical bone-altering technique for that other procedure. The real thing I needed to fix was this os trigonum, which hopefully works, so I can get back into running again. If this other little issue of discomfort is addressed by this, I'll be very, very happy, and fingers crossed that I didn't do something to make it worse. But we'll see. So I went for it. I had both of these procedures done, and now I'm in recovery mode. And I wanted to kind of chronicle my recovery stages so that hopefully somebody can benefit from this, and you have a good idea as to kind of what to expect. And hopefully, with a pinch of luck, we can see how well these 2 procedures address my particular problem, so that if you or someone has a similar kind of an issue, you can kind of have a little bit of an idea as to maybe the types of options that you might have for trying to address this if non-surgical techniques aren't working for you. So today is January 3rd, 2020. I am at full day three of my recovery. I had the actual procedure done on New Year's Eve, which was this past Tuesday. I chose that day because basically I wanted to just get Christmas kind of in the rearview mirror so we could have a nice Christmas with the family. I have 3 kids and wanted to make sure that just, we had all of that kind of good stuff with the family in place, and then, can work on recovery and figure out how to take the tree down sometime in March. So let me talk about the days Tuesday till now and let you know kind of what's working and, what's difficult. So the actual day of surgery was New Year's Eve, this past Tuesday. In the hours that led up to that, as is typical, I think, with any surgical procedure, they want you to fast, before you go under anesthesia. So they told me no eating after midnight. And I kind of thought that was a little strange because they told me I could be the first case that they have in the morning.
at the hospital, and that appointment could be around 7:45 in the morning, and that I would need to be at the hospital at 5:45. And I thought, wow, that seems like not enough time to kind of like let, whatever's in your stomach kind of like work its way through there and be safe to be under anesthesia. So I kind of chose for myself to not eat after 7 o'clock the night before, just to be on the safe side. As it turns out, they had called me the day before and told me that I was going to be the second appointment. So my surgery was going to be at 10:45 in the morning, and I still chose to just not eat after 7, just to be on the safe side. I was a little nervous leading up to the surgery anyway, so I wasn't really that in the mood to have a big meal the night before. I was going to be heading in. So woke up. My wife and I drove to the hospital, and got checked in, and the staff was really, really great. They just took all my information, and there was very little waiting time before they actually got me in there to get me started. So after I was checked in, they brought me back into the patient area where you basically come into the hospital. And, they had me change into a gown. They asked me if I could, needed to use the restroom. They had me put all my personal belongings into a bag. They let you keep your cell phone with you, which is a great distraction to keep the nerves down. They brought me back into a small area where they hook you up into an IV. They get you onto a gurney. And it was great at that point. They actually let my wife come in already at that point to kind of join me until I was going to go in for my procedure. The nurses, came in, they, asked all kinds of important questions over and over again, it seemed, but of course it's just to be on the safe side, just double checking that I hadn't eaten anything, checking for allergies, just checking, making sure that they were operating on the right, right limb, and just making sure that all the I's and all the T's are crossed before they got started. At some point, the surgeon himself came in with his assistant and went over things again. He asked me if I had any questions. And then finally, I saw the anesthesiologist. Now, for this procedure, they basically, and I wasn't sure that this was going to happen, but they do put you under, but it's not considered full anesthesia. It's not, or it is a kind of general anesthesia, but you don't have a breathing tube. Instead, you do go under, you're out, but they kind of refer to it as like you're in a state of twilight. You don't remember anything. I mean, you are out. I mean, out. But in addition to that, the anesthesiologist had me roll onto my stomach, and she inserted a little needle into my back, which I didn't feel at all. Basically, it put a block down your entire leg, or different parts of the leg. I think she described that there were 5 specific nerves in the leg that she could control, and she would discuss it with the surgeon, once I was, they were there together to determine where they needed to put the block. And the block, in conjunction with this kind of mild anesthesia, meant that, you could basically have a kind of a same-day procedure, going home. You don't feel anything, you're not remembering anything, but you do get to go home the same day. If they didn't do the block, apparently you'd have to have general anesthesia, and it becomes a much more involved procedure. She also informed me that I would be numb, and I probably wouldn't have any feeling of pain or pretty much anything in the leg for 24 to even 48 hours afterwards. And that ended up being true, but more on that later. So what was it like from the moment that I got on my belly to the moment I woke up? I don't know. I don't remember anything. The minute I got on my belly, they had put a little a breathing tube, through my nose. They said they were giving me oxygen, but I suspect that there was something else in that oxygen, or maybe they started plugging in something else into my IV, because the last words I remember saying were, "I kind of smell something," because I smelled something interesting or funny in the oxygen, and that was the last thought I had. I don't remember anything. It seemed like 2 seconds later, I woke up and I was on my back, and I'm staring at, like a lady at a front desk, and I'm just like, I wonder if I can talk. And I'm like, hi, and just like waved my hand, and they're like, oh, you're awake. And I knew that the procedure was over, and I could see right away from my right foot that it was in a cast and bandages. Now, the moments that followed were really best described as just a little bit surreal because I can remember certain things, but there's a lot of things that apparently I don't remember because my wife told me that I kept asking the same questions over and over again. And I don't even remember asking almost anything. I remember feeling fine. I remember there was a 7-Up can and some crackers, which I ended up, sipping and eating. I felt completely fine. I had absolutely no issues with nausea or anything like that whatsoever. I mean, I was feeling really, really good. I vaguely remember getting up off of the table. And then I vaguely remember getting dressed and getting put in a chair. And I remember seeing crutches behind me and then getting wheeled out of the hospital. And then somehow they were helping me into the car. And I was just feeling like fine, like, yay, it's over. Like, great. Like now I'm on the other side of this thing. Now it's just all recovery. But apparently there was a whole bunch of other things that were happening that I don't remember. Like my wife told me that the nurses took me to the bathroom. I have no idea what happened in that bathroom, but apparently they had to take me to the bathroom to show that I could pee before they could let me home. So apparently that all worked, but I have no recollection of that. I got through it and apparently got home okay. My mom said that I called her on the ride home. I don't remember having a conversation with her at all. By the time we got home, it was 5 o'clock. So like just to put the timeline together, got to the hospital at about 8:15. My surgery was for 10:45. So, it was right around 10:45 that I went under. They told me my procedure was going to be about an hour, which was kind of interesting that I was going to have these 2 procedures done and only take an hour. My wife told me that I was out probably for more like 2 to 3 hours. But some of that might have been some of the recovery time for me to wake up for enough for her even to be allowed, into the room. For me, it was like the blink of an eye. Like I felt like I was at that hospital for just the few minutes that I was, getting undressed and put on that table to suddenly I'm just going home. So that was, I guess, a good thing for me. There was very little else. It was almost surreal that we were, getting, in the car and it was like 3 o'clock-ish or so because it's about an hour and a half ride, to where we live, and then getting home at about 5 o'clock. So a good portion of the day, had been, gone with this. But came home. My mom was here taking care of our 21-month-old. So we kind of relieved her of that. Thanked her very much for the help for us with that. And she went home. And then I had what I can describe as a fairly relaxing day, just kind of taking it easy on the couch. Getting up the stairs was a little tough because I hadn't used crutches before. There's basically just one or two, there's kind of 2 flights of stairs in our house, but I just had to go up, one of the flights. It's kind of a split ranch. And just got to the couch and, managed to, just kind of lay down. We watched, TV and just basically took it easy for the day. So at that point, I wasn't feeling an ounce of pain. I was actually feeling like amazingly great. And I was really just feeling super happy. Like I made it through the surgery, like the nerves part was over. I'm just, healing at this point and I'm going to get to be on the couch for the next couple of weeks. That seemed like, aside from just the fact that I would be going a little stir crazy, I'm like, I can deal with this. This is fine. My wife was trying to kill me because I kept trying to get up to like help out with the dishes and do all other kinds of things on one leg and hopping around with a crutch under one arm or the other arm or both. And she kept just plopping me back down on the couch, which was the right thing to do. But I was feeling no pain whatsoever. And so that evening and into the night, also no pain. So into Wednesday, waking up, no problem, no pain. Still feel completely numb in my right leg. From about the kneecap down, there was just no sensation at all. About the middle of the second day, I started thinking to myself, well, I wonder how long this is going to last. That seems like a long time to not be feeling anything at all. And so I, would occasionally like just try to see if I could just move my big toe or my little toe, just the tiniest little bit. And it was just like a mind experiment. Like no matter how hard I would concentrate, like I just couldn't move a thing. So, good news was, I guess, no pain, but just a bit of an odd sensation in that there was just no sensation whatsoever. So there was, at that point, I'm not taking any of the medications that were given to me because I didn't see, the need to. The doctor did give me 3 important rules. Rule 1, keep your leg up and elevated. Rule 2, don't get it wet. And rule 3, do not apply any direct weight or pressure to the leg. 3 simple rules. So far, been adhering to all of that, no problem. Just continuing into kind of day 2, was great. We were watching TV, was able to sit on the couch and lean over and play with Play-Doh with my little one and read her stories and, just try to engage as much as I could with her, just all the while being super careful to not let her jump on my leg. And that was fine. So into the evening of day 2, I started to definitely feel like right around maybe 8 o'clock at night, I started to feel some tingling going on in the leg. And I started thinking, I wonder if I can actually feel my toe. So I just kind of reached down and touched my big toe. And I was like, oh yeah, I can actually feel my toe now, a tiny little bit. So I knew that, okay, I guess it's, they didn't kill my nerves for good. That's great. But now I wonder what kind of pain I'm going to be feeling. Because at that point I hadn't felt any pain, like nothing. So I had taken a couple of Tylenol, I think right around 8 o'clock at night, just to kind of get ahead of it. I wanted to try to not take the heavier opioids that were given to me. And I'll go through all of the medications in a second, just so you know what was I even given to take. But right around 4:30 or so in the morning is when I woke up and I realized I'm not sleeping because I'm in pain. I'm definitely feeling it. But it wasn't unmanageable. And I was really going to try to be committed to not taking the opioid level of the medications that I was provided. And I wanted to see, just how, if I can, not be a masochist, but can I just tough it out a little bit and just stay on the more milder Tylenol, the extra strength Tylenol, and see if I can manage the pain that way. So that's what I did. I took 2 more Tylenol at that moment. That was right around 4 in the morning. It was a little sooner than I should have because you're supposed to wait every 6 hours to take it. But I took it at that point, and I was able to go back to sleep about 40 minutes later. So I slept, it was a little bit of a rough night's sleep that night. The pain level didn't get much worse. And I found that I've been able to manage the pain very well with just taking 2 extra strength Tylenol every 6 hours, which is what's recommended per the bottle. But I was prescribed oxycodone, which is also known as Percocet, or it's also referred to as acetaminophen. I have that here. That is, they ended up giving me 325 milligrams, and it says take 1 to 2 tablets by mouth every 4 hours as needed. So this bottle has been unopened. I have not needed to take it. Let's see, what else have I been taking? They did prescribe an aspirin tablet, a little 81 milligram aspirin tablet. This is for blood clotting because I know that you're going to be sitting a lot. So the 3 rules that the doctor gave, really important, especially keeping your leg elevated. I didn't know it at the time, but those first days when I wasn't feeling anything from the blocker still being in effect, that was hobbling around on my crutches, feeling like, oh man, I totally got this. It was great practice on the crutches, but it is not fun at all without that blocker, because boy, the blood starts to go down into the leg and it starts to you start to feel it all in the incision sites, and it just starts to throb. So you really want to be laying down as much as possible with that leg elevated. It was really good that we prepared a bunch of meals in advance. And so it's just really easy to kind of just toss something quickly in a microwave and just have a really, really quick meal or a snack when you're feeling kind of hungry. It's also important you stay hydrated. So you want to try to have, water or something good to drink next to you as much as you can without having to keep getting up. Make sure that you can plan to not be up as much as possible, because even little, trips to the bathroom, they're necessary, but you just want to do it as little as possible because it does start to ache. I also noticed a little bit of discoloration in my toes if I'm up for more than, let's say 5 minutes at a time. It's just really, really super important that you try to keep, the leg elevated so that the blood, isn't flowing unnecessarily, down into the extremities. let's see. So just the other, two rules that the doctor mentioned, very important, don't put any pressure on the leg. That goes without saying. I mean, now that I can feel some sensation there, I know it would be pretty agonizing if there were any pressure, even minor pressure on that leg would be really, really harsh. So when you're using your crutches, you want to be really super careful that you have a good grip, that you have a good stance with what you're doing. Sometimes, of course, it's necessary to put a crutch down, and you may need to grab a counter or grab a bar or something as you're trying to, do whatever you need to do in the bathroom. You want to make sure that you've just you can move as smoothly and fluidly from wherever you need to go to the couch, and hopefully you're getting yourself back on the couch as fast as you can. You really don't want to be up for more than just a few minutes at a time to do whatever, is most essential that you need to take care of. Don't try to be a hero and do the dishes or do the laundry or feed the dog or the cat or anything like that. You really, you can do a couple of little things like that, but every time I've tried to do something, I've regretted it afterwards. You really just want to make sure that you're just keeping your seat planted in your couch as much as possible, because that's what you really need to kind of heal and to get better. So we're at day 3, full day 3. Tomorrow's day 4. I'll reply back with a little update from there. I tried to capture, as much info as I could at this point, just to fill in some of the backstory. I'll see if I need to plug any holes as I kind of edit this together, and hopefully this will give you some insight as to what you might expect if you're planning a surgery like this for yourself. And I'll let you know what my overall experience is like in the weeks and even months that follow, to see how well did this address the original issue that was plaguing me. So that's it for now.
If you made it this far, thanks so much for sticking with me. I know this first video is kind of long, but I had to tell a little bit of the backstory of my condition just to give some context for what I'm kind of going through and relative to the story that I'm trying to tell here in this chronicle. The future videos on this topic are going to be much shorter. I intend to cover all stages of my recovery, including the rehabilitation process, going through physical therapy, right up until I start running again, and eventually, hopefully, end the series with me running an actual road race post-surgery as soon as I'm able to. I've posted a few links down below of some of the research that I've done on Trigonum syndrome, as well as some of the latest literature on the potential effect of the Peroneus Quartus on the aggravation of or tenosynovitis of the peroneal tendons. So if you found this video in any way helpful or insightful, please leave a like, subscribe to my channel, and hit the notification bell. That way you'll know exactly when I've uploaded the next video in this ongoing series. Many thanks again. I'll catch you in the next one.